Reeves, and I'll be talking about health information management.
And I'm the audience.
Consider a scenario that happens daily around the world. A patient is rushed to the ER in need of emergency treatment, and the patient can't tell the ER physician his medical history. Physicians rely on health information in medical records in order to properly treat patients. The patient may have a drug allergy or may have a complicated medical history. Without knowing the patient's history, how can the physician know which treatment is best and safest for the patient? As you can imagine, it is extremely important for medical records to be accessible to physicians in order for them to provide care to their patients. So today I'll be discussing the Health Information Management field, or HIM. I'll also discuss with you the current and future roles of HIM within the healthcare industry. The work of HIM affects everyone from nurses to business executives and even you, the patient. As a student and employee of HIM, I've seen firsthand the growth of this field and the importance of keeping health information accurate and readily available. A career in HIM typically begins with an education from a college-level health information technology program. Skills taught in an HIT program include business management, anatomy and physiology, medical terminology, and coding. Some HIM jobs are entry-level, but most require a credential from the American Health Information Management Association, or AHIMA. According to a 2005 survey by AHIMA, available on ahima.org, most employers prefer an AHIMA credential for positions in HIM, so these credentials can greatly increase an employee's career opportunities. With the right skills and education, HIM professionals can choose a variety of career paths in numerous settings. For instance, coders turn clinical documentation into codes that are used to bill patients and insurance companies. In addition, information taken from medical records can be used to determine future business needs for the hospital, such as, do we need more beds, more nurses, or more equipment? HIM professionals also review medical records to determine if their staff are abiding by hospital policy and regulations in their treatment of patients. Release of information specialists ensure that medical records are available to patients and the physicians treating them, while also ensuring that the records are kept secure and private and released only as allowable by law. Since electronic record systems are becoming more widely used, computer and IT skills are becoming increasingly important for HIM professionals. According to a 2012 press release from Kathleen Sebelius, Secretary of the U.S. Department of Health and Human Services, the percentage of hospitals using an EHR system has doubled from 2009 to 2011, from 16% to 35%. And according to the Bureau of Labor Statistics, the number of HIT jobs in the U.S. is expected to increase by 20% in the 10-year period from 2008 to 2018. Electronic records have arrived, and it seems they are here to stay. According to Bonnie Cassidy's article in the 2011 issue of the Journal of AHIMA, although employee skill requirements will increase, so too will their job opportunities. For example, as hospitals and insurance companies seek to reduce costs, there will be a need for coding auditors to ensure that all bills are correct, and a need for documentation specialists to ensure that all treatment is medically necessary and not wasteful. Because of the broad education of HIM professionals, it appears they will always be a vital part of the healthcare workforce. In conclusion, the HIM profession requires dedicated and skilled professionals who understand the importance of accurate, confidential health information. There are many opportunities for HIM professionals, all of which play an important role in a successful healthcare facility. As technology and healthcare grow and expand, so too do the expectations and opportunities for health information professionals. It's important for patients to understand this field and to be partners in maintaining their own health information. Thank you.